Oh, we're good to start. All right, welcome everybody. Let's call the meeting to order. It is exactly 9 a.m. Thank you all for being here. Let's start with roll call. Shelley?
Allison Welch. I saw her on. She kind of checked. Yep. Ariel Tarango. Barbara Stolfa.
Good morning, I'm here.
Good morning. Candace Williams.
Present.
Carrie Lewis.
I'm present as well.
Corey Usher. I saw him on.
I'm here, present.
Thank you, Corey. Dale Woolridge. Dan Majewski. Deborah Rickick.
And
Dan Majewski's here.
Oh, thank you, Dan. Thank you, Deb. Garth Gamer.
Present, sorry. Online.
Heather Miller.
present.
Josh Gaither. Julie Ogden. She emailed us. Laura Smith. I saw her. Yes. She's showing. Maria Stella. Michelle Guadnola. She's on. Paul Dabrowski.
Present.
Ralph Kelly. Raymond Croas. Shanna Clough.
Hi, I'm here.
Sean Joker. Tiffany Streever. Morning. He's in the room. Tom Flanagan. Yep, we have quorum.
Thank you, Shelley. All right, let's move on to the chairman's report. First, I'd like to draw your attention to the attendance report. Please take a look at that. A friendly reminder to committee members. The committee only works because of your fabulous participation. If you are unable to attend the meetings after missing 2 consecutive meetings, the DHS will send you a note seeing if you want to continue to serve on the committee. Next, I'd like to welcome 2 new members to the group. First, Shanna Clough. Welcome. Shanna, you want to tell us briefly about yourself?
Sure. Hi, thank you. Like I said, my name is Shanna Clough, and I am the trauma coordinator for Mount Graham Regional Medical Center. We're a level 4 center in southeast Arizona. I kind of helped get our trauma program started, and we've been designated since 2014. Prior to that, I was the pre-hospital coordinator, and I really enjoyed my time doing that as well. And I work PRN in our emergency department.
Thank you and welcome. Next up, Dan, who goes by Mojo because I cannot pronounce his name. Dan, you want to introduce yourself for us due to my pronunciation deficits?
Oh, no worries. So I'm Dan Majewski, or Mojo. I'm the EMS liaison with Carondelet Health Network, and I've only been there for about 7 months. I was recently retired from the fire department after about 30 years. And then decided to take on this role. So super happy to be here, and thanks for letting me join.
Awesome. Welcome and thank you both for your participation. Next up, a vacancy report. There are 2 current vacancies. First, law enforcement representative with active involvement in EMS. Should you know of anybody or be one of those individuals, please submit a letter of interest to Shelley. You can see her email address on the agenda there. Finally, we have an EMS council liaison. This role will be filled by a current member of EMS council. With that, I will turn it over to the Bureau for the update. Chief Garcia.
Good morning, Dr. Gaither and committee members. We do have some slides to share with you all this morning. I'll give you a fair warning. They are 30 slide deep. I'm not going to go through all of them in detail. We're going to share out the slide deck with all of our committees today that meet today. So everyone will have copies of these at the end. I'll breeze through some of the highlights, and then several of the agenda items today will go into more detail. So Shelley, if you'll help me, first off, we wanted to share with you all that we have published an updated organizational chart, and the Bureau of EMS and Trauma still continues to roll up under the Public Health Services Division in the Department of Health. You can see that little blue star of life there. That is where the Bureau of EMS and Trauma sits here at the Department of Health under our acting director, Jenny Kunico. And next slide. We have received our appropriation for this current fiscal year. This year we were appropriated $4.1 million in the EMS fund. That doesn't mean that we have $4.1 million available to us. The EMS fund does fluctuate based on moving violations. We like to joke, if you'd like to do your part and contribute to the Department of Health Services, Bureau of EMS and Trauma, you can drive in the HOD lane illegally, and that can really help us out with our appropriation. All jokes aside, we did out of our appropriation we received this year, we did get up to $850,000 this year that was allocated to the local EMS coordinating regions. Our 4 regional councils are receiving contracts that include funding that is specifically also for rural paramedic education. We're really thrilled with the progress we had last year with, I think I heard it was proposed to be 10 paramedics going through paramedic school last year per region. The northern region just reported to us that there were over 80 paramedics that they were able to put through school with some of those funds. So really great work, and we're excited that that appropriation helps us to continue to support the work in the 4 regions. We wanted to also share some of our upcoming activities. You can see a snapshot here of some of the work that the Bureau has done over the last couple of years. The next slide goes on to give some highlights in terms of the Bureau of EMS and Trauma System and the statewide services that we have. We are up to 1,228 ambulances across the state currently, 46 trauma centers versus at 52 base hospitals at this point, and over 21,000 emergency medical care technicians. And big thank you to everyone that helps contribute to these numbers across the state to support EMS and trauma in Arizona. Next slide. I'm going to go a little bit out of order and let you all know that we are going to give a big shout out to all the folks that have been working hard on transitioning to the AZ Peers BEMSTS version 3.5. There are quite a few agencies listed here that currently participate in the AZ Peers EMS registry across the state and have successfully transitioned to version 3.5. This is huge. We know it was a heavy lift. A little bit later in the agenda, we'll talk about some resources and ongoing technical assistance for all of the agencies that are participating. I think it's 2 pages long, actually. So great work, everyone. We really appreciate you. This is a system that allows us to monitor patient care and outcomes and make recommendations to improve the system over time. You guys are awesome. Next slide is some national registry update. I'm going to pause real quick to see if PJ McKay's on the line and has anything really briefly to add.
I am on the line. Just really quickly, I've got some additional information for the Education Council, but with the stakeholder meeting, we had one recently with National Registry. They're revamping their website and improving the landing page for state officials and program directors so they can get additional information in a more clean and easy to navigate fashion on their program statistics as well as state statistics. The BLS practice analysis is ongoing. They're doing some job review and going to be developing some additional items with curriculum, with testing, and with some of the psychomotor suggestions based on that practice analysis when it's completed. The scaled score reporting is going to, it started actually in June 1st of this year, and it is set up to help students that are unsuccessful in passing the National Registry focus on the items that they had trouble with and potentially need some additional work in. So hopefully it'll improve their subsequent chances. ALS psychomotor assessment is again ongoing. They have started the implementation of the new system where there's some scenario-based questioning going on. They're vetting that process right now, and eventually the psychomotor component will completely sunset in July of 25. The formal implementation switchover of the new test will start July 1st of next year. They're starting some initial voluntary accreditation with COAMs, exploring that. It remains voluntary at this time, but eventually we'll work towards that full accreditation program as the paramedics have. There are key initiatives there. There's the link that will take you right to that website. There are a number of different things that they're focusing on in the upcoming years available through that link. And then current resolutions, they passed at the recent board meeting. There's 4 of them that are still open for public comment till the 8th of August. So there's a link there that'll take you right to that page. And if anyone has any questions, please feel free to reach out.
Thank you, TJ. We appreciate you highlighting all those updates and the resolutions that are open for public comments. Our next couple slides are on the SHARE program and the Loxo Leave Behind. Dr. Bradley, would you like to cover those now or later in the agenda?
I'll cover those later in the agenda. Thank you.
Okay, so we'll just breeze through those 2. And this will be in the slides we'll push out. Similarly, here, Shelley, you can just quickly click through them. We have updated EMS and trauma dashboard that Loxo will be on the line to show you all during the agenda today. And the remaining slides, I believe, will be covered in detail as we move along through our agenda. We will make sure that you all have the survey link for some feedback we're seeking on the trauma registry, as well as info on some of our EMS legislative and rule updates. I won't cover them in detail in the interest of time. If there are questions at the end, when we give another update on some of our rulemaking efforts, we'll come back to this slide deck. So I will pass it back to Dr. Bradley. Or
Either
Dr.
one.
Beaker.
I was going to just go to Dr. Bradley. So next up, Dr. Bradley, you want to give us an update on the Narcan Leave Behind program?
Sure. So we being Sebastian, has really been doing a lot of work getting us pretty close to the go live date. So with this program, we've got links in the agenda. The training is live, and several agencies have already implemented their training. The training link is very easy for agencies to use. Essentially, can be uploaded into your learning management system. In order to get the naloxone kits for the Leave Behind program, your agency personnel had to have about an 80% completion. Once you reach that threshold and let us know, we will then send you the naloxone kits. The naloxone kits have kind of a few components to it. It's the actual naloxone. So it's 2 of the intranasal 4 milligram doses. There's also a little resource guide that tells how to actually determine if someone's overdosing and how to give the naloxone. And then also further resources that's specific to your geographic area with resources for patients who would like help with substance use disorder. And so we wanted to make sure that those resources are really specific. We don't want to give someone in Southern Arizona resources in Maricopa County or up in Northern Arizona. So we have resources based in each county. And then Maricopa County, due to the size, we broke into 3 sections just to make sure that people could have those resources. We are just about there. I just want to hear myself echo. The last piece that we are pending is just a QR code sticker. We need to, because this is grant funded, we do need to collect some data regarding this, and we want to make this as easy as possible for EMS agencies. So the actual kit will have just a peel off sticker that the crew will scan the QR code and input 1 or 2 data elements. So it'll be very easy to do. We don't want there to be any barriers to the kits being given out to the community. So that's the last piece we're waiting on. We are anticipating being ready to go here in the next couple weeks.
Great, thank you. And agenda item C, I believe we already touched on, Chief Chris, that one. All right. Next on, let's move to our updates from our work group / user groups. First up, trauma registry user group. There you go. No, yeah, thank you.
Well, the two updates is like Chief Garcia said, to make sure we do the survey for the transition from ESO to the new vendor. And the proposal starts July. And another thing that Carissa started last month, she's doing like a class for new registry. And she does an overview of all the registry and she's doing education now. So that's actually
Great, thank you, Mary. Next up, trauma program manager workshop. Heather.
Hi, thank you, Dr. Gaither. So trauma program manager workshop, we had, the last one was out Matt and Graham with Shanna. They did some ATV, HOV training, and they've actually been working diligently with the Arizona Game and Fish to get a lot of this education out. They've shared a lot of their training materials with a lot of our partners. They gave some updates on the new EMS portal. They did a pediatric trauma presentation and their hands-heavy presentation. Our next meeting is on August 18th in Flagstaff, for anybody interested.
Excellent, thank you, Heather. Next up, EMS registry user groups. I did not hear Ray on the call. Ray, are you on the call? Anyone else able to give an update for the EMS registry user group?
Are they all at the Image Trend Conference right now?
Probably. Yeah. All right, we will skip the MS registry update. Next up, let's move along to our discussion and action items. First up is to review and approve the draft meeting. Those draft meetings should be in your packet if you're attending in person. And I believe we'll be sharing them on the screen. Yep, there they are briefly. Take a moment to review those, and I will open it to a motion to approve or amend as necessary. Any comments or motions for approval of the minutes? Would anybody like to make a motion to approve the minutes?
I'll make Heather Miller, yes.
Thank you. I have a motion from Barb and a second from Candace. Thank you all. Any discussion or amendments requested to the minutes? All right, hearing none, I will call for a vote. Given that we are in hybrid format, I'll ask for responses to all questions. All those in favor of approving the minutes as presented without amendment, please say aye.
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 Thank you. All those opposed, please say aye. Nay. Technically, it would be aye. I am opposed. I'm just saying. All right. All those opposed, please say nay. I'll jump in. And any who wish to abstain, please say aye. Hearing no abstentions or no votes, motion passes. The minutes are approved without amendments. Next up, discussion on the survey of the future of the Arizona Trauma Registry and upcoming solicitation for proposals. Maureen?
Yes, as you know, the Trauma Registry ESO, the product that we have now, is going to go away. And we think, what is it, Rachel, 2025? So the department has decided to open it up for bid. It's going to be, you know, for new vendors to come in, because the product that you have now, even with ESO is not going to support it anymore. So for the level 1 trauma centers that have customized programs, that's going to go away. So we're going to put it out for bid. It's going to be closed bid. This is a new process for me, which is going to be kind of interesting, because closed bid means that once it's out for bid, we cannot talk about it, which is going to be very hard for me. Just saying. Just saying. And also too, if we actually, the staff, our staff will have to sign confidentiality agreement. Like I said, it's gonna be really hard for me. So, but what we really need before that is for you to tell us what we need to look for when the bids come in. You know, our level 1 trauma partners, they have done a lot of customization to the product that we have now. It costs a lot of money because the way the system is now, the base model, the public health model comes, you know, the fees for it comes out of the department's budget. And the trauma centers, if they want to customize the product, they have to negotiate that customization and price for that with the vendor. So what we need is that when we're looking at the contract, what do you want? What do you need us to put in? So, you know, what's the cost? You want, you know, a certain amount of training each year because the ACS requires the, you know, the training on the registry as part of your ACS verification. So we are not the subject matter experts. Actually, I don't have access to the registry. So, you know, but please let us know what you want once the bid closes or once the bid opens. Like I said, we can't ask you questions. We can't talk about it. So we're asking for this information now. So we know what to, you know, look for when the bids come in.
Thanks, Noreen. What timeline are you looking to get feedback by?
Well, they actually wanted to do it now. And then, you know, Rachel's like, no, we have to at least talk to, you know, have a staff meeting first.
Okay.
You know, so I think September is the time that we're looking to actually put it out for bid. And that's when the communication has to stop.
So you're looking for any feedback prior to the next meeting with
Yes.
staff?
Carissa has a survey that she's put out, you know, please use the survey or email us, say, you know, make sure you include this or whatever, you know. So we really need this. You guys need it.
But I think they're looking at sending the survey in the middle of August to have the scope of work done by.
Okay, thank you. Any other questions about new bids going out for trauma database services?
I just want to add that we'll look forward to talking with Dab about it, and then the goal in terms of implementation would not be until July of 2025. So all of our trauma centers do have time.
There's 35 agencies that are 3.5. They're like,
Hey,
we wanna
Tom.
meet all.
Tom, do you have a comment on the survey? So our ultimate timeline is July 2025 that we're aiming for when we would replace the registry with the new product.
Perfect. Thank you. Any other questions, comments regarding that bid and transition? Okay. Let's move to agenda item C, discuss technical support and resources for agencies transitioning to AV Peers and NEMSIS 3.5. Julia.
Yes, thank you. So Anne couldn't be here today, but I have a really quick update. As Rachel mentioned, we again want to thank all of the EMS agencies for all of the work and time that you've put into the transition process, including as was on the screen, the over 120 agencies that have already transitioned to version 3.5. It was definitely a team effort. EMS data is looked at statewide and nationally, and it's really important for quality improvement. So thank you again. Transition resources continue to be available on the Bureau of EMS website. I'll go ahead and put that link in the chat. So if you go to this link and then click on the B3.5 transition resources, there continue to be resources available for reference there. Of course, if you have any specific questions, please reach out to Anne. Oh,
We have a question.
oh, we have a question. Okay.
Hi, I'm sorry to interrupt. I was curious, we have been working with our vendor with 3.5, changing to 3.5 for a while now. And most recently, we've seen a substantial drop in our compliance with AZ Peers data submission. Meeting with our vendor, it sounds like almost all of this is back-end issues on their end with linkage, and they do not have an ETA for any fixes for that stuff. So my question is in the past, I believe it was decided that agencies would have only 1 month of below 90% compliance before they would lose their premier status. And I'm curious if there is any wiggle room to extend that, since 3.5 is a pretty substantial change from what we've done previously.
So one of the things with that, we will have to kind of look at the overall data quality that's come in, because we do have a large number of vendors in the state. So if we see that that's the same issue across all vendors, then certainly an extension may be made and we can make some adjustments. But we'll need to look at and work with Ann and see what the data looks like across the vendors.
Okay.
Thanks, Matt, and thanks for the response. Other questions regarding the transition to 3.5? Okay, Julia, you are not off the hook yet. Next up, discuss the next steps for the EMS and trauma needs assessment and workforce study.
Yeah, thank you. All right, so thank you to everyone that participated in our individual and organizational surveys that have been out the last couple of months. For the individual assessment, we got over 1,100 responses, which is pretty good. So thank you to everyone that participated in that. And then for the organization assessment, we got 99 responses, a little less, of course, there. But thank you again to everyone that participated in those. Next steps for us regarding the need assessment will really be to look at the assessment data, kind of see what some of the responses were, and then take it to you. We plan to host some stakeholder groups in the coming months through the regional councils and some other groups. And so we're really looking for input based on what we received in the surveys, and then really looking for any gaps that we might have had into the data that we collected there. So the next steps will be to hold some stakeholder focus groups. So please stay tuned for information on that. After that, we're planning to engage stakeholders in plan development to identify priorities and strategies. And then the implementation of the plan that we developed will not be until January 2025. So we have some time there, but those are the next steps for the needs assessment and strategic planning. Any questions?
Questions regarding the needs assessment survey? A lot of work, and thanks to everybody for their inputs on it. I'm sure it's great data. Excited to see it coming out.
I have a request. Can I revisit roll call for any members to join actual?
Yes, absolutely. So small deviation. I think we've had some joining and maybe moving away. So this is your attention if you've been spacing out. We're going to redo roll call for those members on. So Shelley, you have a couple people?
Well, I was thinking anyone who missed it.
Anyone who missed.
Okay, is there anyone who we missed at roll call that would like to now say they're here?
I would like to say I'm here. This is Francis Ali Osman, TMD at St. Joe's Hospital in Tucson.
And
And Christina Henry from Havasu Regional Medical Center.
Got it.
Any family members?
Allison Welch from Queen Creek Fire. I'm not sure. I put it in the chat, but
We got you, Allison. Thank you.
thank
Dale?
you. Thanks, Josh.
Yeah, thanks, Josh. I'm here.
I think I saw Laura Smith as well joined. If you are having issues with your audio, you can also type it in the chat. We do need, for our roll call purposes, people to either come on voice or in the chat if they are in the chat.
This is Brett Hawken with Central Arizona Fire and Medical Authority.
So, and this is just for TEPI members. Thank you.
There you go. Laura.
Laura, we got you.
it.
Thank you.
Good. So anyone else?
No, thank you.
Okay. Let's return to our agenda then. Next up, Vatsal. Vatsal's on to discuss the Arizona EMS annual dashboard update and data.
For you guys in the field.
Dr. Davies, on mute, please.
Right, and I feel like it's relatively inexpensive.
Dar, did you have a comment on the?
I think we got it.
No, I'm present. You were asking the group here.
Okay.
Thank you.
Thank you.
Softball on today.
So do you want to share your
Oh,
screen?
I certainly can share my screen. Yep. Good morning, everyone.
Good morning, Vatsal. Thank you. The floor is yours whenever you want to start.
Yeah. All right. Can you guys see this?
Yes, we can.
All right. So, our EMS annual report has been updated. We have latest 2022 year in the report. There are few changes I have made in the report. So I'm not gonna go through the entire one, but I will show you the main, changes we have done to the report. We have several filters now available at the top to look at the EMS demographic picture. Apart from the year, we have agency type. So you can select either air and ground to, modify the report accordingly. So if I do the air transport, then it tells me there were how many total EMS incidents were reported through the air agencies, like 21,000, and that may be average daily of 58 cases per day. We also have over here the filter available for type of EMS service requested. So you can filter it through either 911 or just for the interfacility medical transports. And then we do also have the EMS region feature available. So selected to look at the selected EMS region picture. So, and then it will change the numbers accordingly. The part I want to talk a couple of things is about the primary and secondary impressions. We have few impressions over here to look at the number of incidents, mortality, age and gender, and county distribution. These are not the only primary impressions collected by EMS agencies. There are many, many other, but these are some of we cannot put each and every primary impressions over here. So some of the primary impressions of interest, selected by the Bureau are over here. So then by default, it's going to stay cardiac arrest just in an alphabetical order. And so it tells you how many cardiac arrest cases, what is the mortality, now dead at scene, how many were dead at scene, and died in hospital. So this died in hospital part comes not from the EMS registry. This EMS registry then retrospectively gets linked to hospital discharge database, and we pull the outcome information from the hospital for those patients. So that's the mortality in the hospital, just so that we know that on scene, it will give us a complete picture of mortality. So dead at scene and died in hospitals, and it gives you the complete picture over here. In the introduction part, there is more information available for how the linkage is done and what percentage of the linkage is happening every year. And the one page I want to talk about is the response time. This is a new page we have added this year. As you see, we have median response time, like a scene time for 911 ground incidents. So all the cases are limited to, incidents are limited to 911 ground incidents only. So we have a median response time, median scene time, like on scene time, and then transport time if they were transported to the hospital. So these are the three response time is reflected over here, and the distribution is given by the county for the mean response time. For the scene time, distribution by county was not that useful, so we decided to put the scene time by primary impressions, because that's where it matters, that, okay, how much, you will see the different pattern by the primary impressions. And again, for the transport time, again, that does not matter, again, the primary impression that much, as much as, which part, geographically we are so diverse, like, which part of the county patient is gets transported to the hospital, takes longer or shorter period of time. So it gets reflected over here in the times. What is the one thing I want to point it out is that if there is a response time data missing information in everywhere I have kept it, like scene time missing and transport time missing information. And we are very good in getting information on the response time. If we see the scene time, we have 14% missing, and then when it comes to transport time, we have 20% missing. So some of the data quality issues are also being reflected on this page. And we have one more, like we have now 3 years to compare. my plan is to see if we can go to the 5 years, but right now it is so huge and it takes otherwise a lot of time to upload. So we are working on that part so that we can get a 5 year of picture. But currently now there are 3 years to do the comparison. That's about it for the EMS report. If anybody has any questions, I can answer right now, or any comments, any future suggestions are welcome.
Thank you, Vatsal. A few comments. First, amazing work. This is incredibly valuable data. I think for the whole room, the state of Arizona, the Arizona Department of Health Services has been phenomenal in linking this data to the hospital discharge database. That is not something that's available across the country. This is an amazing resource. I would encourage everybody to use this. We integrate it in our education to help illustrate why it's important. It gives that local flavor. In addition to encouraging our paramedics to complete all their data field by highlighting the incomplete, the number of incomplete records. It's easy to illustrate how your data can become skewed when we just leave out a simple field. So encourage folks to take a look at this. It's an incredible resource, and Vatsal undersells the amount of work and the value that this provides for the entire state. So thank you, Vatsal, for all the amazing work. Any other questions, comments?
And I'll just tag into what Josh said. I think historically the Bureau put together kind of a paper or PDF EMS annual report, and our goal has been to transition to this format, which is really, I think, much more useful for agencies and hospitals. That allows you to compare your data, really customize your field of what you're looking for based on your region or county level data. And so really a big thank you to Vatsal. I know this has been a year plus in the making. So she gave a very small overview. So please take some time and go to our website, review some of this. Like I said, it's really easy once you start clicking through the Tableau dashboard to look at the different data elements. So a big thank you to Vatsal for all of the work on this.
Thank you, Dr. Bradley. I just want to point it out one more thing over here. If in the introduction page, there are these 3 bars which are like clickable, and then this will actually give you more information. Okay, over here, 2022 linked cases. And if you say the link to HDD, how many were total grant and how many were linked to HDD, the percentages are shown over here. So, you know, it just opens up all the information more on the methodology of this report.
Great, thank you, Vatsal. Any other questions or comments for Vatsal?
You're awesome, Vatsal.
Indeed. All right. However you like before, are not off the hook yet. Moving on to the next agenda item, which is also falls under you, is to discuss the share transition on the data side. You want to give us an update on the share transition?
Sure. So right now, our IT team is working with the university to transition the entire CEDAR applications over to the ADHS. So that process is, meanwhile, while this process is going on, we have made sure that the hospital side part of the shared database where hospital goes into CEDAR applications and enter their data, that part is completely available to the hospital as is. We highly encourage hospitals to submit their data on their time schedule. While we move through, as soon as we figure it out, the transition, everything, the applications, we will be able to answer the hospitals if they have any questions regarding the cleaning, regarding the deleting the records or anything like that. But meanwhile, we encourage the hospitals to continue submitting the data as is. From the month of August, I think their IT person at the university is right now not available to work with us. So that's why we are taking it a long time. But as soon as that person comes, the process will be really fast, and we are hoping that we will be able to fully functional, by in a couple of months. That's my estimate.
Thank you, Vatsal, for the update. I think maybe just for the benefit of the group who may not be as familiar with the SHARE program, SHARE is incredibly valuable to our state. Despite that amazing dashboard that Vatsal shared with us, simply looking at paramedic primary impression of cardiac arrest and mortality doesn't give you a detailed picture of cardiac arrest survival in the state. Through the DHS operation of the shared database, we as EMS agency medical directors, leaders, can get the detailed information about cardiac arrest survival that we use to make meaningful changes, such as the Utstein survival rate, all that type of data. So thank you, Vatsal, for all the work in getting that detailed data necessary to continue to improve cardiac arrest survival in our state. It's a ton of work, and we appreciate the continued effort.
Yeah. So, and also, like, you know, because this in EMS part of cardiac arrest data comes from EZPOS itself. So having shared registry with the within ADHS, within the Bureau makes a lot of sense. As you know, we also have the EZPOS within in-house. So that part will be really, you know, beneficial to the shared registry moving forward.
Absolutely. Matt, I see you having your hand up.
Yeah, sorry, very needy today. Is the idea that once this person comes back on, that they'll still be providing the same feedback as SHARE was historically, with individual cardiac arrest feedback for the agency, and then annual reports for that agency, comparing it to the state?
Yes, that is the plan, that we will continue to have all the functionality available as soon as, you know, we it gets kind of settled down, understand the applications and figure it out, everything. Yes.
Okay, fantastic. Thank you.
And thoughts on that, maybe I can just clarify. I know there were a couple agencies within the state that were getting more individualized, like case by case reports. Those are not going to continue. What we are looking forward to kind of dovetails into the next topic, which is the SHARE kind of registry user group, is really what we would like to do is, and we had voted as a committee previously to form a SHARE user group. Just with all of the processes of just the data transition, we have not yet held that committee, but the goal is to bring that user group together in the fall to really start looking at how can we potentially improve what those agency reports look like. We want to make sure that moving forward, we're giving the right data and the right format to agencies to make it user friendly. So the goal is to expand that group in the fall. But to your question, Matt, I think your agency was one of the ones that had specific call level data reviews. Those will not continue.
Okay. Thank you for clarifying.
That's all.
Great. Any other questions, comments about the SHARE transition and SHARE user group, unless you had other comments on SHARE user group?
Nope, I think I covered that unless anyone has any questions regarding that. TEPI had voted to form that. We just have not yet scheduled that meeting because the team has been really busy. We've had to hire a few people to interviewing, hiring, and transitioning those databases over. One last thing is we did communicate out to all the cardiac receiving referral centers. They should have received notification that their data entry was going to be taken over by ADHS as of July 1st. That communication went out this week. From an EMS agency perspective, this should be really seamless. Your data is still going to ADPers. That's always how we got the EMS side of the data. The only thing that's going to change is the hospital data piece. Right now, that was going into University of Arizona directly. It is going to be transitioning, coming into ADHS directly. So that should be the only change.
Thank you for the update. Any other questions about the SHARE program? All right. Moving along to the next agenda item, discuss, amend, and approve the draft updates to the bylaws. For those of the committee members, please see the packet, the printed version in your packet, or electronically available on your screen shortly. I will run through these changes real briefly. From my opinion, there are no substantive changes. However, we'll run through them. You can see in red on page 1. We simply changed the verbiage slightly. As you look on to page 2, there is a new paragraph inserted to make sure that we disclose what it means to be a member of this committee. That includes the requirements to participate in some training. Section 4 allows clarifies that voting by email is not allowed. Section 4 at the bottom, sorry, Article 4, simply clarifies what has been the kind of unwritten agreement on appointing someone to the position of chair. You can see the red language there at the bottom. I won't read through it for you. And almost there, on page 3, there is only one small change, again, grammatical change. And then finally on page 4, the addition of Article 11, work groups just put into the bylaws here that the committee may authorize work groups as necessary, which is what we have been doing in practice already. With that, I'd like to ask for a motion to approve these.
Move to approve.
Second.
Thank you, Garth. With that, we'll open it for discussion. Any discussion, question, or comment?
So just a couple comments. One of the things the Bureau had realized we need to include was there is a requirement for open meeting laws regarding the training. So we wanted to make sure that was in the bylaws because we had on some of the committees some issues getting all the members to complete that required training. We do want the bylaws to be as consistent as possible across the 7 different committees that we have. So that was one thing we wanted to make sure that was added. Also specifically with open meeting laws, you can't vote by email, but that wasn't in the bylaws before. A lot of the open meeting law requirements require there to be clear cut who is actually voting. We have had some issues in terms of attendance as well. We are going to ask that the committee consider that your attendance be confirmed by either being off in person in the room, coming off mic on the phone, or typing in the chat with your own login so that we know you're in attendance. We've just had some issues where there's been questionable had someone been in attendance for over like a 2 or 3 year mark, and we can't really tell whether or not they've actually participated. So we do want to keep the committees open and give people the opportunity to participate. So that is the one request to potentially add that.
Thank you. Other comments, questions?
I'm sorry, are we changing verbiage or anything?
No.
Okay.
So I think in terms of the attendance section, do you want to add the verbiage about attendance for roll call? Or do you feel that that's just covered under open meetings?
Okay. It probably wouldn't hurt to lay it out.
Maybe under the attendance section.
Okay, regular attendance.
So that is page 3, section 4.
Members want to be able to communicate via voice or chat.
Communicate their attendance. Or in person, obviously. We'd love for you to be in person, but if you can't.
Okay.
Yep. Great. Any other comments, questions, requests for additions, subtractions? Okay, hearing none, I'll call for a vote. All those in favor of approving as presented with the one small change on attendance, please say aye.
Make sure. Aye.
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 Any opposed, say nay. Any who wish to abstain, please say aye. Hearing no abstentions or opposition, the draft bylaws have been passed. Next, let's move on to discussion of ground ambulance rulemaking. Chief Garcia.
We are moving right along. Shelley, can we go to slide 23 from the earlier deck? Well, I will preface this by saying that it's not our intent to turn the TEPI meeting into a rules meeting, but we really wanted to do our due diligence to make sure that we are communicating out to everyone one of the large rulemakings that we are doing in the state right now. I wanted to share with you all that we are conducting ground ambulance rule listening sessions in each region of the state. And we are still seeking public comment through the listening sessions and online surveys on the ground ambulance draft rule. These slides do have links to quite a few of the drafts that we have, as well as some of the upcoming sessions. Next slide. These are the drafts that we have posted currently. You can see that there are Article 9, 10, and 11 June drafts that are available online right now. We did post most recently an Article 12 July draft, which is our time frame for ground ambulance licensing and registration. And we also posted an ARCR draft online. And we're seeking comments on those before we move forward with consolidating and posting another draft for public comment. We have one more regional listening session scheduled tomorrow in Tucson. And it sounds like there's a hybrid option, both virtual and in person for that listening session down south. And we're really appreciative of all the other regions that have hosted sessions as well that we were rounding out this week. Next slide. Some of the proposed changes that have been put forward in the most recent drafts are outlined here. I'm going to cover them really quickly in summary. First and foremost, all of the draft changes that we are putting forward as the department here are 100% focused on patient care. And as House Bill 2609 outlines, really ensuring that patient care is central and the primary decision-making thing that we consider at the department moving forward. So the summary of the proposed changes are really, in essence, to align with House Bill 2609 and the certificate of necessity requirements that are focused on patient care effective January 1st. Also in that House bill, it is now a requirement that all ambulance have a GPS monitoring device installed by January 1st. This rulemaking package is intended to define that GPS monitoring device requirement that is now in state law as of January. We're also aiming to streamline online applications and payment processes. The department has made huge strides forward with implementing the new Image Trend EMS and Trauma Online portal in the last year. The goal is to integrate all of our CON applications, so all ambulance services will be able to go to the portal and access streamlined online applications and payments moving forward as of January. The draft also clarifies ground ambulance service contract rates and charges. All of that is outlined in Article 11. It also outlines interfacility transport and critical care requirements. And the goal with those definitions and making sure that those items are really clear in the rules package is to be consistent with federal EMTALA and Medicare guidelines, and also open that door to be able to build on critical care standards in this state and really raise the bar over time as we look at other rulemaking, such as training and certification moving forward. Next up, we are establishing statewide response time and dispatching standards, and that is based on evidence-based practices. We aren't just proposing response time standards here, we are also coupling that with dispatching standards and ensuring that we are recognizing best practices that are utilized nationwide. We're recommending response time benchmarks based on the 90th percentile for urban, suburban, rural, and wilderness areas. And finally, standardizing existing performance improvement reporting requirements. And these are reporting requirements that folks in this room and across the state are already adhering to. We're really fortunate because in our state we have almost 170 agencies that already adhere to AZ Pure's reporting, and we have a great opportunity with that database, as you all know, being able to really look at patient care and outcomes and use that information to be able to make recommendations to improve patient care over time. So that, in a nutshell, are really the high-level items that this rulemaking is trying to address. I have a couple more slides, and then if there are questions, we'd love to open it up and see if anybody has any comments. There are some proposed response time standard benchmarks that are being evaluated in this next draft, and there's a work group that's going to be meeting to discuss these proposed response time benchmarks. Here is a link to an interactive map, as well as a proposed map layer, if anybody is interested in pulling that data and looking at it from a GIS perspective. We are looking at 90th percentile benchmark and establishing those for urban, suburban, rural, and wilderness areas to have that benchmark established across the state. Next slide. I wanted to talk a little bit about the proposed response times and performance metric reporting, and I have a handful of bullets to go through. I think if appropriate for this group, being TEPI and the work that you all do, making recommendations for performance improvement in the state. I wanted to share with you all AZ Peers patient care reporting can satisfy the reporting requirements that are being proposed in these draft rules. And the reason that we are sharing that that is an option and that it can satisfy some of the reporting requirements in the rules is that it does not add additional administrative burden to the agencies that, of course, already participate in the system across the state. The proposed department required format that we're putting forward here, it does include timestamp for when 911 and PSAP calls are received. We also have timestamps for when ambulances are dispatched and really detailed dispatch and run level data that are available for organizations to be able to use and conduct performance improvement activities. AZ Peers patient level information is still protected. It is still statutorily protected. And you all know the value of that data and how it can be used. What we're proposing here is that the AZ Peers reporting requirements connected to response time are what can be used to satisfy some of the reporting requirements. In this rules package, it is still outlined that CON holders must also make dispatch data available. All records have to be retained for a period of 3 years per statute, I believe. And no surprises here. We want to make sure everybody knows, according to the new laws that go into effect in January, the department will be required to make response time data publicly available on our website. We all saw a presentation from Boston earlier. We do have great data already in terms of response times, and we have the ability as a department to be able to build out those dashboards, to be able to make that data automated and available moving forward to meet this new statutory requirement that goes into effect in January. So that's a little bit about performance metric reporting moving forward and what is being put forward and proposed in the draft rule. From a TEPI perspective for a minute, putting on our TEPI hats, this really is a tremendous opportunity for us to be able to standardize reporting moving forward, to be able to improve our data quality and to really be able to relay that foundation and build on it moving forward. So next slide real quick. We really are looking forward to getting some additional feedback on these draft rules. We are still in the informal rulemaking stage, collecting feedback from diverse stakeholders across the state. As I mentioned, we've conducted multiple listening sessions. We've done several work group meetings going back to even 2020. The timeline that we have ahead of us is laid out here on this slide. Our goal is by July 31st to post a revised draft that will include a consolidated draft of everything. That's Articles 9, 10, 11, and 12. And our next step will be to file a notice of proposed rulemaking. That kicks off the formal process where the Governor's Regulatory Review Council becomes engaged. It starts a 30-day formal comment period when we do file that notice. On October 16th, we would tentatively have an oral proceeding. October 24th is our deadline to file what's called a notice of final rulemaking. And the reason that's our deadline is because the Governor's Regulatory Review Council still has to review and approve these rules in order for them to go into effect. That council will meet on November 28th and December 5th to review the rules. And if they are approved by the council at that time, that we affectionately refer to as GERC, if GERC approves, then the rules would go into effect January 1st. The reason that that is our goal is because that is when the new statute will go into effect. That new House Bill 2609 will go into effect January 1. So this is our remaining timeline with the rulemaking. We wanted to come to you all at the committee meeting today to make sure we're sharing this information on our timeline, opportunities for public comment, and just to thank you all for that collaborative approach and being able to get feedback from everyone to incorporate it to this draft. That is rulemaking in a nutshell. Dr. Gaither and the Southern region get to hear this spiel again tomorrow when we go down for a listening session. I will pause there and see, are there any questions on that?
There's a comment in the chat. What about looking at hospital offload time?
That's a great question. We do have, I can't see who asked the question. But Allison, we do have in AZ Peers the ability to look at timestamp and measure offload times or out of service time. And there is an opportunity to be able to monitor that. That could be a project that we work on with TEPI. That could be a project that we form work groups around moving forward as we continue to move the needle on standardizing and improving our reporting forward.
That would be great. Thank you very much.
Thanks. Any other questions, comments? Okay. Hearing none, the item number 7 is simply a call for agenda items. If you do have an agenda item for our next meetings, please send that to Shelley for consideration for the next meeting agenda. And next, I will do the call to the public. Comments, questions, concerns? All right. Hearing none. Upcoming events, we got a ton. We got the Arizona Tribal Transportation Safety and Injury Prevention Summit. We have the 28th Annual EMS Educator Symposium, Arizona Ambulance Association meeting, the Traffic Incident Management Summit, Phoenix Children's EMS and Pre-Hospital Care Conference. In addition to the note there at the bottom to please visit the Bureau's news and conferences webpage, as well as training program page for upcoming opportunities. With that, our next meeting will be November 16th, and we will adjourn this meeting. Thank you all for attending.
Thank you, Shelley.